Good morning. So my name is Amanda Gaskin. You're here at Ultimate Health Direct Primary Care. I am the owner and the primary caregiver here. But I realize a lot of people don't know what we do. You're probably here because you're getting weight loss. We do more than weight loss. We do weight loss and we do it really, really, really well. But we do more than weight loss. I am an adult and geriatric nurse practitioner. I specialize in primary care, which is why we're direct primary care. In primary care, you can address from the rooter to the tutor. I can do from headaches to hormones, women's health, men's health, testosterone, hormones, obesity, depression, anxiety, all of it. I can manage your high cholesterol, your diabetes, some of your autoimmune diseases like lupus and all those things. In primary care, we can do all of that. But here at Ultimate Health, we do it a little bit differently. We don't accept any health insurance. And there's a reason why. There is a method to our madness. The method is this. When you're in primary care and I've been seeing you and you and I have this relationship, it's not like urgent care where you only see me when you're sick. You see me when you're well because we do well visits. And we built this relationship. And then there's latest technologies because I'm staying up on all the latest trends in technology and health and all that. And I decide, hey, one of the best drugs for you would be Well, the insurance company would say, no, you should give them the $4 medicine. Well, the $4 medicine causes weight gain. So like in diabetes, the mainstay or front one is metformin. After metformin, it's glipizide. After glipizide, it's Actos. And so there's like all these levels. And then for a diabetic, you could end up on 6 different pills before you even get to insulin. Whereas you all know GLP-1 medications like Mounjaro, Ozempic, Trulicity, and then the pill form Rybelsus, those are also diabetic medications. Well, I know that Rybelsus is a game changer. I know that Ozempic will change your life. Not only will it make your waistline fine as wine, but it'll also lower your hemoglobin A1C, which is your diabetic grade. But your insurance company would make me play this stupid game with them. In direct primary care, they don't tell me what to do. They are not the boss of me. I am the boss of me. And we work together. In direct primary care, we can just skip the middleman, the insurance company. I have time because with a traditional healthcare model, we would have like 2,000 patients assigned to us. In direct primary care, we only take 400. So being in this Cool Kids Club is very exclusive. It's 400 and it's intentionally 400 because my patients have 24-hour access to me. My patients text me day, night, weekend, or holiday. So even when I'm not here and I'm off being in love with my new husband, Robbie, I can still get a text. But if I gave 2,000 people my phone number, I'd be getting texts all night long and I could not play kissy face with my new husband. But if there's only 400 and I'm spending the time that you need when we're together, then there's no bother. When you're texting me on the weekends or at night or on a holiday, it's truly because you need something. It's usually something really quick because in direct primary care, we spend time. That first visit with us is 90 minutes. It's 90 minutes of going through your thorough health history. I'm asking about your parents. I will tell you to call your mom. I will tell you to call your wife and ask her what your mom told her about your family health. Because these things are important. I need to know, oh, grandpa had what? Well, how old was he? Or how old was your cousin, that one cousin that's your mom's sister's daughter that had breast cancer? I need to know these things and I have time. Whereas if you've been to the doctor anytime in the last 10 years, you already know time is not a commodity that they have. It's a time that we have in direct primary care because we're not taking on so many patients. But in order to do that, we can't bill insurance because what insurance does is you will come in and you will have your insurance. I saw you for a visit and I'll bill your insurance $150 for that visit. Insurance is gonna pay me, if it's a good one, $68. If it's Medicaid, $28. So imagine how many people we need to see if we're only getting $68 per visit. Well, if we're getting $68 per visit, that means we, honest to goodness, need to see about 40 people a day. Well, 8 to 5 p.m., 40 people. That leaves how much time for each one to be seen? 7 minutes. 7 minutes. That's 7 minutes to tell me your thorough life history, for me to get labs, go over 7 minutes. That is not enough time. I need to get into a deep relationship with you. So each patient, new patient, is allotted 90 minutes with us here at Ultimate Health. And in those 90 minutes, we go over a thorough health history. Nadia gets an EKG. We draw your labs that day. I can, even if you've brought me records, I can review those records. If you've given them to me in advance, I review them. I've got my notes and I'm like, okay, so I see that back in 2017, you had a hysterectomy. Something I'll ask is why? I don't just take that you had a hysterectomy. Why? Oh, it's because you had cancer. Oh, it's because you had fibroids. Oh, you used to be anemic and now you're not, but you tell me you're anemic, but you're not anymore because you had the hysterectomy that fixed the anemia. In those 90 minutes, we have time to make all that. It's like being a scientist. I have all the time I need to figure out what's best for you, not cookie cutter, stamping out the same protocol for everybody. But if we're accepting insurance and we only have 7 minutes, that doesn't work. So what we do is we collect a once a month, affordable monthly fee. In doing that, I've already been paid. My staff is already paid. Our electric is paid. Our internet is paid. We've already paid our bills. So now the only thing we have to do all day long is take care of you. That's all I have time to do. Take care of you. I'm not worried about, oh my God, I need to get more patients so we can pay the bills. No, God is blessing. We're paying the bills. Now it's providing quality health care. But we can only do that and that flat monthly fee if there's less than 400, because again, I want to give quality. If I start accepting too many people, then the quality is going to get stretched. You know how it goes. You get something and it's exclusive, it's good. It becomes available to the public, it's not so good, it gets watered down. We're not watering down. We're giving you straight up what you need. So at Ultimate Health, we do primary care, but we also do weight loss, which you already know. That's why you're sitting in our lobby. You're getting your weight loss, and we do that very well. And we figured out a way to work around insurance and all that stuff, and it runs very seamlessly. We even added rooms so you could get in and out, and you don't have to miss work. We have Saturday hours, so you don't have to miss work. You can get in and out, get your weight check, get your shots, and go and be blessed. But we also do intimate wellness. Ladies, you have babies and you sneezing and you crossing your legs when you sneeze, that is an unnecessary extra step. I sneeze gap-legged, sneeze in confidence, cough, laugh in confidence without going. And you know what that means. I'm not going to say it because some fellas are watching. They don't need to know our business. But if you look, there's a sign for the Alma Femilift. The Alma Femilift, it talks about, it's vaginal tightening. It uses a laser, and I go in and it cauterizes and it doesn't hurt. Cauterizes that first layer of the vaginal lining, causes new collagen to form, thickens the lining of the vagina, so now it supports your bladder better. So now you cough, sneeze, laugh at a good old Chris Rock joke, and you're not going to wet yourself. But you also get some added sensation. And you know, after you've been using that thing 30, 40 years, it's not as sensitive, but if it's got brand new skin, it's sensitive, honey. And also moisture. We've got more moisture. We've got more lubrication. I don't want to be in our business. I'm just telling you what we do. That's the Alma Femilift. There's the sign. Look right there. Fellas, I didn't leave you out. I'm not getting the girls all robo-charged and leaving you hanging. Right over there is the Alma Duo. The Alma Duo takes shockwave therapy, and shockwaves, I put it right down there in the sweet spot. Shockwaves go in. It's painless. Everything's painless. Creates little micro tears in the blood vessels, and then the blood vessels heal. Well, when they heal, it makes new blood vessels. So if there's more blood, there's more firmer erections. That's waking up with morning wood. That is spontaneity. That is not, wait, sugar, let me take my pills. It's going to be about 30 minutes before we get the show on the road. No, it is, girl, if you come out of there with that towel on again, it's going to be a problem. It's that. That's what the Alma Duo does. But ladies, that same technology can be used if downstairs is not as sensitive as it used to be. I put shockwave therapy on the main event. New blood vessels are flowing to the main event. If a joker brushes across it, woohoo! You having a good time. That's the Alma Duo. So we do primary care, weight loss, sexual wellness, and then those hormones. We're all aging, and I am very sensitive to the aging process because although I look very youthful, this is CBD. This is the benefits of that CBD cream over there. I look so youthful. I'm not youthful, honey. This is 41 all day long. This is class of 2000. This is 1982 born all day, every day. So I'm very sensitive to the aging process, and the needs and hormones plays a part. You've had a hysterectomy. I did. I was 35 years old. I had a hysterectomy. Left me with no hormones and all the things that come along with that. So I was just as crazy and batty as your wife is. Hormone replacement, I do that. Fellas are aging. My lovely, amazing husband, he is so precious, and he looks young too, because we're both very youthful looking, but he is not young. He is aging. So we have all those needs that that come along with aging. We're replacing those hormones with BioT. BioT is implanted little rice grains right up under your butt cheek. Takes me seriously 10 minutes to get it done, and that's because we're waiting for it to get numb. Place that under there, your blood vessels start forming across those little rice pellets, and then the hormones are taken into your blood, so it's not getting shots every week. It's not having to take pills and creams, and it's not the peaks and the valleys. It is, you've got hormones that you used to have in your youth, and it's based on your blood. I draw your blood, and then we find out what your needs are, and then I implant that amount of hormone that you need specifically right up under your skin. So we do primary care on a membership model, and you get the 24-hour access, and your labs are included, and you have unlimited office visits. Did I say unlimited? I said unlimited. You don't get sick and go, oh crap, I don't have the $25 for my copay. No, you're sick. I go, get your butt down here. Come on down here, and I'll write your work note, and I'll give you medicines, because we've got meds here. I can do IVs. I can do IV antibiotics. You come and get some big bad cootie, I can give you IV antibiotics right here in the office, or steroids, or whatever the need is. We have it's like a little mini hospital, because our goal in primary care is to keep you out of the hospital. If you go down there, you better be having a baby or a heart attack. That's the only reason to go to the hospital, a baby or a heart attack, or if you need surgery on something. But if we do prevention enough, all your pieces and your parts might stay good longer. So if you have not scheduled with your own primary, maybe talk to Sony and ask her about ours. Take some brochures right there on the table. There's some brochures about all of our services. I would love the opportunity to provide your primary care, to partner with you. I'm not one of these people who tell you what to do because I wear the white coat. No, it's your health. You've had that darn body for 49 years. You know about it. I'm just learning about it. So we'll work together. So if you do not have a primary care provider, go on over there to Sony, get scheduled, find out how much it costs based on your age, and the membership is based on age. If your hormones are out of whack, BioT. If you're downstairs, not downstairsing, Femilift Alma Duo, and all the things in between, because again, we do mental health. I'm really good at that, and I won't always slap you on medicine. I might even give you some CBD. See that CBD stuff down there from Banner Harvest? That's my girl Yolanda, baby. I sleep like a baby. Between BioT and Miss Yolanda CBD, I'm like, why are people waking me up? It's so good to see you, and I hope to see you soon.